Hi, my name is Susan Salvo, and today we're going to do chair massage. After you have your client in the chair, you're going to spend a few moments with adjustments of the head and the knees and the arms and the seat height. And once you're nice and comfortable, you're going to establish a form of communication. So what I'd like for you to do, Alicia, is if I am hurting you, raise a hand up. And if you want more pressure or you like what I'm doing, thumbs up. And then if you don't like what I'm doing, you're going to put a thumbs down, okay? So just kind of communicate with me. Usually you're getting chair massage in a loud and crowded area. And I cannot see her face, so I cannot tell if you're grimacing or grinning. So be sure to communicate with some kind of gesture. So you're going to start with just compressions of the back. I'm using two-handed compressions just to say hello. Now we only have, a little less than 10 minutes, so we have to cut some of the things that I normally do out. Now I want you to notice the body mechanics. My back is straight, my leg is back, one leg is forward, creating a stable base. This will change as I'm working, but try to keep your back as flat as possible. The first thing I'm going to do is I'm going to go to her left shoulder, and I'm going to start with just some one-sided compressions down along the top, and then I'm going to switch to some finger circular friction. I'm focusing on the area on the top of her shoulders. I'm actually even contacted the area into the supraspinatus fossa, feeling for the vertebral border of the scapula going just, if I think about this a second, just medial to that, and then I'm going to work in the area where the musculature is, some of the traps, some of the rhomboids. She's got a little spot here. When you find a spot, you can do a couple of things. You can do a brace finger compression, static compression. Notice I'm not doing this. This is not good for your little joints. I'm bracing the finger, and my wrist is relatively straight, leaning forward with my body weight. You can also do a circular friction. You can do friction with your digits, called digital friction, or finger circular. You can go cross fiber. You can even use your heel of hand and do some friction. Or you can go in with your elbow. And I think this is what this is going to need. This is a pretty bad little knot. You can see me going clunk, clunk, clunk. This is her muscles. So I'm going to just spend a little time. Some people like this move. This is affectionately called the can opener move. You find a spot and you flex and extend your elbow, move up a little higher. How you doing, Alicia? Okay. And higher and down. Now you can introduce some movement. These are Tragerlike movements. I'm grabbing with my fingers and heel of hand the upper traps and shaking them while I'm moving her shoulder. Another nice movement I like to do is to take my arm underhanded, or my forearm I should say, and cradle her arm in it. I have her head of her humerus in my hand. You can do a couple of things here. You can do a push-pull. I'm moving her scapula with me, with my top hand. You can begin a circular movement like this, noticing my flexing and extending of my knees to make this happen. Okay, I'm not doing this with my arm. It's my whole body's involved in it. You can move the scapula back. This is a nice, you can get this angle with, I'm getting underneath her scapula a little bit, working the area between the spine and the scapula, and hopefully getting here. You can even sneak a little pec work. Woo-woo. This is usually pretty sore on massage therapists. Am I right? Yeah, she's been doing student clinic all day, so I know she's a little tight there. You can work a little into the deltoid, always appreciated. You can get infraspinatus spots here. Just working the shoulder as much as you can. In a longer, more traditional chair massage or seated massage, you can work down into the bicep, tricep. You can get the flexors and extensors of the wrist, and you can get down into the hand really nicely, okay? From here, I'm going back to transition On the other side, I'm just going to say hello to the back again. And I want you to notice how a lot of the shirt has been pulled up. Every once in a while you want to come and just kind of smooth the shirt back down. Coming onto this side, I'm doing some rocking compression using a combination of heel of hand, thumb, and you notice the direction here is at a diagonal. I'm trying to press into the spine. This technique is also really good if I were to work in the low back on her QL, which is a mess, but that's another show. So here we're going to go back up here. I heard her chuckling, so am I right? Yeah, okay. So here we're going to work the area again between the scapula and the spine, working on the top, trying to get the shirt away, smooth it out. There you go. You also can ask her to move her chin down a little bit. What that's going to do is that's going to give you a little bit better access to her neck. I'm taking my fingers on one side, my thumbs on the other side, and you can do some nice little circular frictions into the lamina groove. I think I do lamina groove every YouTube video. It's one of my favorite spots. As you know, also the suboccipitals. And the suboccipital direction of pressure is going toward her frontal bone. It's hard to see, but this is the direction that I'm going, moving up with one hand while I'm on one side of the body. I'm also starting to walk around here, and I'm using the circular friction on both sides of her occipital bone into the suboccipital muscles. And I want you to notice my feet now. I'm pulling back, or leaning back I should say, with so much pressure that if I were to let go, I'd fall back against the wall. So you can do this on both sides at the same time. You can isolate it on one side at the same time. You can do one side with a little bit of upper trap compression. You can stop and do just some trap compressions. Actually, this is circular friction movement. Just kind of play around with what works. Make sure what you do to one side, you do to the other side. You can do this alternately, simultaneously, moving my way back up to the, you okay? Alicia, you all right? Going into the suboccipitals again, I'm going to start moving a little higher onto her scalp. And circular friction. Instead of sliding, notice I'm lifting up my fingers and moving them what I want them to go instead of sliding across her hair. I'm going to go on this side now, a little bit more circular friction while I'm going to do my closing movements now. Of course, you're going to spend a whole lot more time if you're doing this as a chair massage and with a regular client. Yeah, she definitely needs some more work here. I'm going to spend just a few more moments on this spot, dropping. I want you to see this real quick. As I drop her scapula down, I create a little more space here, lengthening out the muscles. And I think after the video, we're going to have to do that again, Alicia. Getting her shirt smoothed down, and we'll start with some hacking to potom now here, or percussion, also called percussion. You notice my fingers are slapping up against each other. You can do a quacking whack, 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 whack movement. You can do a cupping movement. You can do a loose fist pounding movement, which I think I will do here. Then you're going to do a tapping movement. And you can even tap lightly on the head, not too hard. And then you're going to close with some nice smooth movements, and I hope you enjoyed this demonstration. I hope you enjoyed your massage, and I hope to see you later. Bye now.